ultrasound study is regarding a mass relating to the upper pole of the right kidney with patient age 58 years, male, with the history of pain, sudden pain he suffered from, and hematuria. This is the only findings that have been provided to me. Now this is the right kidney in longitudinal section, and it's gliding over the iliopsoas muscle. Here we are. Now if you see that this up to this region measuring 7.7 in length and 3.9 centimeter in anterior-posterior diameter, the right kidney is normal, outer surface is smooth, the cortex thickness is normal, the echogenicity of the cortex is normal. These are the medulla, and the medulla are normal. So the corticomedullary differentiation is intact. This is the central sinus sacrocomplex with no calculus seen in this region. Hydronephrosis is not seen, and this portion, the lower pole, this is the lower pole of the right kidney, this is the mid region of the right kidney. So these two regions are normal, whereas there is a solid heterogeneous mass seen sharing the capsule of the right kidney. You see, this is the capsule of the right kidney, and it's sharing it, it's elevating rather, it's elevating the capsule of the right kidney. And it's more echogenic compared to the renal parenchyma. No, this is the renal parenchyma. So, and there are few cystic areas also seen within it. And this is the right hemidiaphragm, no fluid seen. Above the diaphragm, no fluid appearance seen. This is the liver, which is normal, because if we compare the echogenicity of the right kidney with that of the liver, it is almost equal. So it should be like that. Now this solid heterogeneous mass which relates to the upper pole of the right kidney, this is the upper pole of the right kidney, this is the lower pole. It measures 66 by 56 millimeters, and we will say it glides over, it moves with the kidney. You see, in this view you will see that this mass moves with the kidney, which glides over the iliopsoas muscle. Now the another point to be noted is that whether we have to see whether it's an intraperitoneal or retroperitoneal mass. All retroperitoneal masses elevate the retroperitoneal fat line anteriorly, and this is what you will see here, that the retroperitoneal fat line is being elevated anteriorly. This retroperitoneal fat line is being elevated anteriorly. So this mass is retroperitoneal in location, relating to the upper pole of the right kidney. Now this is the transverse section in which you can see the patent vessels can be seen. This is the renal artery, this is the renal vein, and there is no hydronephrosis seen. Proximal ureter is not dilated, and you can see the patent vessels at the renal hilar region area. These all vessels are normal. This is the transverse section of the right kidney, and now if we study the mass only, then you see that the mass is echogenic with multiple cystic areas and as well as hypophoic areas seen scattered within it, representative of either necrosis or degeneration. Now comparing it with the renal parenchyma that is normal, of that of the normal kidney, of the right kidney, we can see that this mass is more echogenic compared to the parenchyma of the right kidney. Now the Wilms tumor, in Wilms tumor, what we see is that the mass is really soft. It's soft in appearance, and this retroperitoneal fat line is being elevated, and there is no significant posterior wall enhancement or through transmission. This is not the transmission that or strong back wall that we label as when we see it. So what is the status of the IVC is very important to be seen in such cases. Now this is the IVC, and it is patent, normal caliber. And what you will see is that the mass is posterior to the IVC, which is also again a very important point to be noted, because retroperitoneal masses will be seen posterior to the IVC. This is the mass, and you can see it's posterior to the IVC. Patent IVC. This is the porta hepatis. This is the region to see the para-aortic lymph nodes if they are. This is the aorta longitudinal section. This is the sperm-mesenteric artery rising from mid-celiac axis. So no issue with this. Now the spleen is normal. No fluid seen in this part. The kidney is the left kidney is absolutely normal. It's no mass or no hypernephrosis or calcification seen in this. Now, do we see any calcification in this mass? We have to see that and study it. I'm going to magnify a bit to see whether there is any calcification. Now, there is no calcification seen within this mass. So multiple cystic areas are seen. Now these are the cystic areas being seen within this solid mass, which raises the now there are two possibilities in this patient. One, this can be adrenal hemorrhage, and secondly, it can be hypernephroma or renal cell carcinoma, for which further investigations will be required. This is the cystic area within this solid mass relating to the upper pole of the right kidney, and it glides over the you see, this is a small cystic area, well demarcated. Small cystic area, not cyst but cystic area within this mass, and it does raise the question of possibility of adrenal hemorrhage. This is the prostate and urinary bladder of the patient. This is the urinary bladder. Urinary bladder is normal. This is the prostate. This is the prostate in transverse section, seminal vesicle. Sorry, this is the prostate in longitudinal section. Yeah, this is in longitudinal section. This is the seminal vesicle, and this is the prostate in transverse section. This area. So nothing, no findings seen relating to the prostate, as well as the seminal vesicle. This is seminal vesicle, the urinary bladder, and the regional vessels don't show any findings. So, well, this is a case study of a solid heterogeneous mass, echogenic, more echogenic than the kidney, routing to the upper pole of the right kidney, and raising the capsule of the kidney anteriorly. The retroperitoneal fat line is seen being raised anteriorly by the mass. It's seen posterior to the IVC. It has multiple cystic areas within it. As such, no significant calcification is seen. So this is either well-demarcated adrenal hemorrhage, case of adrenal hemorrhage, or RCC, for which further investigations will be required. But this is how we can study this sonographically. Thank you very much.